This is Matthew Cook with Arrowhead Dental Laboratory, and today's presentation is a little bit different in that I will be sharing a conversation I recently had with Dr. Downs as he was getting ready to open his practice back up to see regular patients after the mandated closures due to COVID-19. Many of the resources that he'll mention throughout this presentation will be available on our website at arrowheaddental.com/back to work. So without further ado, we'll go ahead and get started with the presentation. Dr. Downs, I want to thank you today for taking time out of your busy schedule to talk to us and share with us those protocols and procedures you're putting in place so that you can open in a safe and effective manner. And so let's just go ahead and get right into that.
Pretty much broke it down into like a threefold process here.
Okay.
And then we launched it today. The first fold was to launch a e-blast and text message to all our patients at both locations, just announcing we're back and up and running, full service as of Monday, this coming Monday. So that was our first thing. The second thing was in that launch that we sent in the emails, we said that you will be getting a wellness call from our office. So be expecting that. So now they know. So today was the call-in campaign. That was our second fold. So today was the call-in campaign. And then the third fold was that we did a video clip. So the video clip is just showing, like, get one of your employees all in their PPE equipment on and show them actually cleaning an operatory. The first of that was social media launch and directing that through our email and text messaging contacts to all our patients, letting them know that we are open, we're excited, and we stated about the sterilization, and then that they will be receiving a wellness call. Second fold was today, the calling campaign. That's a big day. You're going to need a lot of team members on hand. You're going to need to practice these verbal skills that we're going to share with everyone. And you have to practice this with your team so that there's not a lot of so they totally have to role play this. And then as they were doing that, I was up there listening, and every time they got off on a phone call, we debrief with them and then tweak their verbiage and then practice again. If you get a hold of the patient who was scheduled and needs to be rescheduled, we got that verbal skill. We don't want is for you to go, well, we're calling to see if you want to come in. Mm-hmm. No, you're not. You're calling to assure that you're ready and you're here, and you assume that you will be seeing them. If a patient then is concerned with the dental protocols during this time, how to respond to that, we've got those verbal skills. And as you read the verbiage, you'll see it's not saying, well, would you like to come in? No, it's like, so we're calling to let you know we'll be expecting to see you. And then if you get a hold of a patient who's overdue, we got that verbal skills.
I was going to say, so how did you get your staff members on board with doing that, and kind of did you give them the verbiage ahead of time? Can you kind of just take me through the process of you guys, how you got the team told about that and how you got them doing it?
Yeah, they were told about it at yesterday's meeting. Today, they had an actual verbiage cheat sheet, if you want to call it that, of how to handle the call.
So it sounds like to me that you use the wellness calls as a way to build team morale as well. I'm just curious, you hinted that it seemed to be a positive experience. Can you just kind of describe for me the change that it had on your team and kind of what you guys are coming out of it with?
Yeah, it's almost like if everyone's been so quarantined that there's been a sense of loneliness. And I get the sense of that with a number of my team members, as well as patients, as being quarantined and not having their daily routine. And so having done this with the team and practicing, and then even having I listen to one and I go listen to the other. The doctor's got to be really good about this on their verbal skills and listen for the ums and words that aren't professional and or conducive to creating certainty about your dental practice. And so, for example, one she said 6 ums, and when she got off the phone, I said that was pretty good. Yeah, Jasmine, you said 6 ums. So and she's like, really? I didn't even notice. And then another girl turned around and she goes, yeah, I heard it a lot too. Dr. Downs worked with me on this. And so in the next call, she got it down to 2 ums. The third call, she got it down to no ums, and then you saw her eyes light up, and she got excited. And then by the fourth call, she was like, sounds so certain, and the patients could feel her energy to the phone to the point where the patient's like, yeah, I want to get my teeth cleaned. I want to come in. And when she hung up, she had the aha moment of, wow, I just made a difference in someone's life. And I gave her an elbow. I can't do a high five. So, at the end of that day, they must have called 50 people each. And on average, we were successful on 90% of those calls. On 10% are the ones that you could feel the patient, maybe we should, and they go, no problem, Mary, let's do this. Let's go ahead. I'm going to put you out to mid-May. Or how about end of May? Great. Well, let's look at a time right now. Oh, it's totally already scheduled. So, all right. Let's do this. Let's tentatively put you in June, the first week in June, and I'm going to put you on my quick call list. And if things free up in May and you feel more confident about coming to see us, we'll make that happen. Does that sound fair, Mary? And Mary's like, yeah, great. I miss you guys. And now the team member gets off the phone going, wow, I am getting this now about how to communicate to people. So when they walked out of here today, the 4 of them, including the hygienist, I had the hygienist calling. They're going to stumble, they're going to bumble in the beginning, yet when it all was said and done, they felt like they made a difference today. That's what I mean by them feeling positive and energetic, and now tomorrow they're excited about coming back.
That sounds great. And I know you run a tight ship. I know you in your practice, and you've kind of had to cobble this together within the last, 72 hours. I'm curious, can you offer any advice as to other doctors as to when they should start this process, if they know when they can open? Is this like a week-long process?
Totally.
Is this
Yeah. It should be a minimum of a week. If you get under a week, it's going to get tougher for you calling it because, and I don't even think, I think if you even know that you know for certain your date that you can reopen, I would be making these calls 2 weeks, maybe a week and a half. Maybe a week and a half to a week is good. I think if you get closer to 2-3 days, then patients are going to feel like, oh, you're just trying to get me in there. Where in these wellness calls, the message is, and just like we talked on some of our other webinars, is that having that communication with your patient base. And we have been doing that through social media and on a consistent basis, and Facebook and Instagram, and putting out words of encouragement and showing, that we're here doing emergencies, and people were excited that we were open for emergencies because a lot of practices weren't. Yet at the end of the day, they were happy we made this communication and finally we got to talk to them. They're like, wow, I was wondering when you guys were going to call us. They're like, oh, right? And that for the team made them feel like it wasn't just a job anymore. This was about relationships. This was about recreating a connection with our patient base and helping them in our journey with them. And then the third fold was that we did a video clip. So the video clip is just showing, like, get one of your employees all in their PPE equipment on and show them actually cleaning an operatory. And autoclave, sterilization, make it look nice and clean, take a picture of the front reception area with the social distancing in the chairs, and the front office, take a picture of them with their masks on, and them cleaning the counters, and and make a fun little video.
I'd say, kind of going back to that social media thing, you did videotape, someone wiping down one of your operatories and putting on the PPE and all that, and you're using that as a way to reassure your patients via social media and kind of make them aware that you are taking these precautions and that your practice is a safe place. Is that correct?
Yes.
Okay.
So we want to create a visual for them so they know what that means. We're doing full dressing of the clinical chairs, which means that's something that goes over that whole thing. It's not just spray the chair down. That's the threefold launch right now, and I was really happy with it today.
And as you've been kind of ramping up and letting your team know about opening on Monday, have you had to deal with any team members who were afraid about coming back to work or concerned about being exposed to COVID?
We had negative team members responding at or concerned. They know that we are in a high-risk industry, as well as the ear, nose, and throat people, as well as the MDs or anyone on the front line. And in reviewing that with the team members, that was my meeting yesterday. So maybe one thing for sure is that before you launch, you meet with your team. A good 4 hours will go by in a heartbeat, but to go over these protocols and to assure your team what you're going to do. My team was looking to me for leadership during this whole process. We did. We made early on orders for PPE because I saw back in early March that this thing was starting to ramp up, and so we made those orders. So we're able to now easily go through a month at both locations with our current supplies. However, today, anticipating that we can get it in June, we made another order because everything's out of stock. So your ordering supply person should be pre-ordering at least for a month out. To expect it to get maybe at end of May or in June, and as this starts to wind down, but for you to be able to continue so that your team knows that you got the protective equipment. We ordered the shields. We got the shields. We got plenty of that, and the only ones out there that may give you a little bit, and you got to be very much a leader with your hygienist, is that they're hearing things to their portals about how risky it is and that they should be getting paid hazard pay. And I'm like, well, then everyone should be getting that. And if that's the case, then there's really no need to have a business because everyone's at risk. And I made that pretty clear with my team in the beginning. I said, we're all at risk. You have a choice. If you don't feel comfortable coming back, let me know. And if that's the case, I have the choice of laying you off and hiring someone who's willing to get back in the trenches, because it's no different, in my opinion, than what we've been doing with influenza, hepatitis, HIV, all those. We use universal precautions.
Okay. So just for a point of clarity, I mean, different team members will have different levels of exposure. Could you just kind of give us a synopsis of the different types of PPE you're giving, like your front office staff versus your hygienists versus the doctors and assistants?
Every doctor is going to need to check their protocols and what they're being told to do, and from every state, they're going to have different guidelines. For
Right.
the operatory, we've been given ours. We are not being required to have N95s. We are required to have level 3 masks, which are surgical masks and filter out pretty good, reduce the aerosols, like hand scaling for hygienists for now, or you can use things like isolite or the dry shield system that goes in the mouth, and it just takes suction. I mean, it dries up. You don't get aerosols. I mean, and then there's, some companies now promoting these vacuum systems outside the mouth for aerosols. I don't know if that's necessary right now, but for front office, their PPE will be strictly level 3 mask, not N95 mask. And then they have also gloves in dealing with transactions. And we've asked them to put the credit card machine on top where the patient puts their card in by themselves, not us, to reduce as much, touching of things between every hour. Of every hour, they're to clean the countertops and the doors. We're leaving our front door open into our front office as they come in, bathroom doors, things of that sort, wiping down, always wearing gloves. And they if they choose to wear eye goggles, they can. It's not a mandatory thing. However, in the clinic, where a lot of that is close proximity, it's much more involved. And so you can use the level 3 surgical mask as well as N95 mask, keeping the aerosols to a minimum. High-speed evacuation is going to be necessary. We have a 2-fold system where we can use 2 at the same time. Keep the water spray down on your handpiece. So on the back, face shields as well, and gowns. And at this point, doctors are going to be wearing scrubs and leaving them on premise, and there'll be daily washings of that. And team members who have uniforms through the practice are not to remove those. They leave their uniforms there, so they come in street clothes, they leave in street clothes.
Okay, so it sounds like your front staff, they're pretty much using the surgical masks. People in the clinic are using the face shields, the higher grade masks, and some kind of gowning to go over the front. Is that accurate?
Yeah.
And now,
as well as their uniforms.
Gotcha.
They leave the uniform.
And are you swapping out gowns between each procedure, or given the scarcity of supplies, are you using the gown for the entire day?
Yeah, great question. If the gown gets soiled, you have to dispose it. And so on our doctors who are wearing disposable gowns, we have washable gowns for the assistants and hygienists. If they get it soiled, they're just going to have to throw it in the laundry and use a bleach, product in there. If not soiled, because of the scarcity of it, we're hanging them and spraying them down with the Lysol on the front surface and back surface. They'll probably have 2 or 3 through the day, so you just rotate them.
Gotcha.
Hair bonnets. We're going to do that as well. Where we used to just do that in surgeries, everyone will be wearing a hair bonnet. And those will be disposed at the end of the day. So they leave that on unless it gets soiled somehow. And that doesn't come off. That stays on all day. And the front office can wear one if they want to. It's not been a recommendation at this point. But in the clinic, because of the aerosols, we're going to wear those hair bonnets.
So let's shift gears a little bit and ask the question, what are you doing to bring patients into the practice? Do you have an intake protocol that your staff is following? And if so, kind of what are those various aspects to that intake protocol?
With the patients, upon entering, scanning their temperature, logging it in their notes, and if they're at 99.5 and above, we'll reappoint them. Then they will come up. They have to stay about a 6-foot distance from we got a little tape on the carpet, so that then they reviewing the COVID consent form and then sign off on it that they don't have a dry cough or a temperature or they've been in contact with someone, or, all these questions, right? So they sign off on that, and then we review it again with them, and any updates on their address, phone numbers, insurance, all that stuff. And this is the reason, so if they have a new insurance card, that's why the team up there will have disinfectant wipes and everything to wipe the card. They'll be wearing gloves and, scan their card. Then once they're checked in, we communicate through our communication system for the whoever, the hygienist or the chairside, to come and pick up the patient, take them back. Once they take them back, before they sit down, they're asked to rinse their mouth and gargle with it for 30 seconds. And you can use Listerine. It's got a high enough alcohol content, or Paradex, chlorhexidine mouth rinses, Closes, stuff like that sort. And because they're right by the sink, we thinking logistically, then they can go ahead, spit out, rinse their hands, wipe their mouth, and then we sit them down, and then we go through their medical history one more time, and then ask them any questions, that might reveal that, maybe they did come in contact with anyone. And then upon relieving, post-op instructions will be hand-given. They'll all be emailed or text to them. And then they'll be appointed in the back, so they don't have to stop at the front anymore. And the only reason they would have to stop in the front is for making payments. But I'm trying to see if we can't get that pre-collected and when they first come in. So no more transactions. Cut the transactions down.
So, as far as, are you scheduling work as you normally did before, as far as the mix of procedures, or are you breaking it out?
Yeah, great question. So, no, we are not scheduling as normal. In normal scenarios, we would have overlapping procedures where patients are coming in at 10 minutes while you're finishing up with another patient. We won't be doing it. So we've gone to linear scheduling. And if you have assisted hygiene, which means the hygienist is going to see 2 patients in that hour, that means you got to have overlap. We're not doing that as well. I wouldn't recommend doing that. Things will stay linear so that you can move patients in and out pretty effectively. And because your operatories are a good 6 feet apart, one of the things we have is we do have HEP filtration in every op, but it's up through the ceiling. So as soon as the patient comes in, they should be seated in the treatment room. So no one's hanging out in the reception room, even though they can. But we're also asking patients not to bring their kids or other people unless it's a guardian or someone under 18. But then if they drop them off, the parent can go to their car.
Okay. Sounds like you have a protocol in place for assessing the health of your patients as they come in. Do you have a similar protocol for assessing the health of your team as they come in the morning?
Yes, absolutely. So when they come in, first thing that they are to do is wash their hands. The protocol there is, I'll read you what I got here. Okay, for team members, upon entering, washing hands, change into their uniforms, check their temperature. To record it, we create an Excel sheet, so everyone's got their name on it, and we're going to do it 3 times through the day. So lunchtime and at the end of the day. Our protocol is if it is over 99.5, they will be sent home.
Okay, and now you mentioned you're logging it. Why are you logging the temperature readings? What's the thought there?
So that you can because you've seen people, they'll come in, they feel fine in the morning, by midday they're like, I feel like crap, and all of a sudden it comes on, right? And they try to push through to the end of the day because they want to have, hours for compensation. We don't want that, right? We don't want them, they're feeling sick, we're sending them home. But the other protocol on that is there was something that I listened to a gentleman here who's talking about medical practices, and I pretty much I'm doing what they're doing, and he said they're doing it 3 times, and the reason for that and logging it is to make sure that also for liability issues, that down the road, if you were a patient said, well, I caught it at Dr. Downs' office, and well, I wonder how did you catch it? Because none of us were sick, and here's our log. None of our employees did it. Here's what we've always done. So just to cover CYA as well, but more importantly, to really make sure your team members stay healthy. So when they come in midday or at their lunchtime, and when they leave, all uniforms on site, bring their clothes to change. Things get thrown in the washer's set for cleaning. So we have, I don't know, 5 uniforms. There's a different color every day. So they're not to be heading home with that.
And I assume you're doing laundry every night just to make sure you have enough stuff. Okay.
Yeah.
So it sounds like you have this pretty dialed in. I'm curious, in this entire process, what were some of the big lessons you guys learned as you went about planning this out?
You know, I think the biggest thing is to watch what the employees do, meaning they're not cognitive of the fact of touching their face. When they leave the operatory, they have to be gloved. They're not to enter any sterilization or sterilized area or a clean zone with dirty gloves on or soiled uniforms. I think that's probably been the big thing for everyone, just to, even though you think that they're doing it, one of the big lessons I learned is just those little things, right? Is that, I don't want you, taking just one glove off and coming in and going into a clean zone and grabbing something. I want you to take both gloves off, wash your hands, now go get to the clean zone, get what you need, come back, re-glove. That was probably the biggest thing that we've had to go through, and just protocol on just being aware. Be aware of that stuff.
All right. Well, I think what you guys have put together is really impressive, and I think it's going to be really helpful for other dental practices. They look to opening their operations and doing so in a manner that's both safe for patients and for the team members within the practice. Any last things you want to convey or thoughts that you had that you would like to share?
You get ready to do this launch. Get the team totally ready and get them excited about it. They want to come back to work. Your team, I would say a good 99% want to come back to work. And it's the job of the doctor, the leader, to now step up, because if you don't bring the energy, they're not going to be excited about coming back. They're going to be scared. So if doctor, you're one of those type of doctors who, well, what if this and what if that? You're going to have to knock that off and step up and say, we can handle this. We've done this. We'll take these extra steps. I care for you, and I care for our patients. So let's get back on our journey of helping people keep their teeth a lifetime. You got to come out with that type of, I'm not scared. I'm here to help. That's all I'm saying, is that when you come back, don't be wishy-washy. You got to be sure of how it's going to be, and now's the time to step up and be that doctor and leader that your team always envisions you to be. I'm not telling you to be a difficult dictator or anything of that sort. I'm telling you to be caring, but be strict.